Hey everyone, welcome to another episode of Dentistry Beyond the Numbers. My name is Dr. Marc Liechtung, and I am your host to take you through a journey of what I'd like to believe is the dental profession. Dentists today need to learn, in my opinion, the 5 modalities that create great productivity and great quality. Today, we are going to attack the thumb. The Hamsa, which we introduced, is the 5 modalities that we believe, that I truly believe through my experience, will create a great clinician. And a great clinician will have a fantastic career with everything that comes with it. Work-life balance, financial sustainability, profitability, and then a great exit. And that's what we're trying to do here at Dentistry Beyond the Numbers. Today, we attack the thumb. The thumb is all about clear aligners. Clear aligners really was something that came into our profession around 20 years ago and came where it took all of us by storm. Many of us didn't believe it. Thought it was an ortho product or an ortho appliance needed to be done by orthodontists. But boy, were we wrong. You know, I make the analogy of clear aligners as I did when I first came out. I had a group practice and I brought in a periodontist and an endodontist. And I learned early on in my career that the words dentistry begets dentistry. Well, what I mean by that is dentistry done right and done on a patient develops more dentistry. For instance, if you don't refer out a molar root canal, well, then Monday the molar root canal is, let's say, done by your specialist. If it's a vital tooth, you might be able to treat that tooth right there, restoratively, because they're in the office. Or at least they know where to come in the next couple of days to have it restored. There's no trouble sending them downtown or across town and worrying about the fees because you control all that in your office. We know all that. Periodontics was something that when they would do surgery and they would do crown lengthening or gingival, whether it be a gingival graft or a gingivectomy, you would see decay on the root and you'd be able to restore it right then and there. Maybe it'll lead to more crowns. Extractions would lead to more implants. Subsequently, I see that over the years with clear aligners. Clear aligners has really been something I was always fearful of because it's not something I really was trained on early on. But when I saw these phenomenal associates coming in and doing it, we're going to get into the economic factor about that as well today because it's really something that's very shocking if you just realize how little you have to do to develop such great revenue. And we're going to talk about that. But I think clear aligners had to develop had to battle a lot of sort of obstacles. General dentists thought, or any bit of ortho is only to be done by the orthodontics or the orthodontists because they do orthodontics, right? Then fast braces came out, which are banded braces. So a lot of different products came out, but which one did I think would be the first or the easiest way for a doctor to come into a practice and start right away? In other words, if I took a young doctor into a practice, in some programs they have to get certified, they have to get knowledge to be able to do a clin check or to do it on their own. I'm looking for something. And today there are a lot of companies that bridge clear aligner companies to the doctor. And that is because they're helping the doctor get educated. Well, I said to myself, there's got to be a product or a company out there that does clear aligners that takes away all the fear. Is it really financially profitable? Is it good for the practice? What do I have to do to get it established? Well, these are all things that took time when I would see associates come in. And they're 2, 3, 4 weeks till they get the course, till they get certified, till they go online, it's value wasted. And it's our ability to get our doctors implemented into the practice to do these procedures that take a lot of time. So today in Dentistry Beyond the Numbers, I want to introduce action plans as it's associated with the Hamsa. And what I mean by that is I don't want to just tell you that clear aligners are a great opportunity and it's the thumb of my hand and from there we grow. I want to explain it to you, and I want you to know that getting started is now easier than it ever was. You know, to me, the biggest factor of why GPs haven't done it is really the fact that they're nervous about it. They don't want to have time to learn about ortho. They don't want to take the courses. They don't know if they need the special scanners. It's too expensive. What happens if I don't do it? So what I'm finding is a couple of factors. One is you have a dentist that has a Main Street practice, 4 ops, a hygienist, and he has 2 or 3 ops for himself. How does he implement clear aligners when he's in practice for 25, 30 years? He wants to do it, but he doesn't do it. One easy way is to hire a young associate who does clear aligners or who wants to do clear aligners. The next opportunity is to do it yourself. Now, some older docs would say, I don't know if my patients are geared for it. I don't know if my hygienists are geared for it. That's where you have to take the helm. You have to take the role of saying, we're bringing in a new product line. It's going to help our patients. And we're going to get into it soon, how well it helps our patients. It helps our patients because it brings more quality dentistry. It helps our patients because it brings more periodontal health. And it helps our patients because we're delivering quality care in the office where they don't have to travel. And convenience these days is very important. So these are the things that I think are very important to bring in clear aligners. In particular, I found a product and a company that has great customer support, and it's OrthoBrain. OrthoBrain is developed by an orthodontist, and I feel like it was totally ortho-driven for the GP. And what I mean by that is that there is no certificate or no classes. You learn by practical learning. And to me, that is an exceptional situation. What you're doing is you're taking cases, and we say, well, let me see this case. And I come into the practice on a Thursday, and I'm doing an exam on a Thursday. I literally can scan that patient and send them over to OrthoBrain to be evaluated by one of their many orthodontists. And why I think that's so important is I've seen, and I didn't just pick this program, I've seen associates in different companies, in different programs. They're all fantastic, and please don't get me wrong. I just feel with guides that OrthoBrain gives you, the guidance, the customer service that they bring you, there's just dentistry develops or begets more dentistry by your knowledge base growing, literally hearing a treatment plan done by an orthodontist. The next case you see something similar, you're going to draw back on your experience, and it's only going to make you a better clinician. Plus, with some of these doctors like myself, who's a little afraid at the time to get started in something like this, you literally have somebody that's holding your hand. You're holding your hand doing these cases. And if it's not a case you want to get into, then maybe it's over your head. They'll tell you that too. So the beauty of OrthoBrain or that type of situation is that I feel that them in particular gets our associates and even a skilled and, let's say, experienced clinician, if she or he wants to get involved in clear aligners after so many years, OrthoBrain gets them involved in nothing more than an impression. Now, we're going to get into further details about OrthoBrain, but I really want to talk about, what does clear aligners do for us? What do clear aligners mean in the sense of practicality for the practices? I mean, first of all, I always believe that if you draw back on your experience and you think about it, I believe that being able to present or the ability to have this in our armamentarium keeps quality doctors in our practice. Let's face it, today is about succession. The groups talk about succession, what happens when us docs age out, who's coming after them. If you have to start an ortho program while you're trying to phase out, that's very difficult, doctors. And this is an incredible point. If you're looking to phase out, maybe you don't have an associate or you have an associate, but you're not doing a lot of clear aligners. You're referring out a lot of surgical extractions. You may want to think about bringing those things in-house for the next 12 to 18 months to develop a bigger exit. Clear aligners is the easiest procedure to bring in because what I'm presenting to you in the thumb of the Hamsa is a clear aligner that allows you to have a conversation and a disc. And we'll get into all the perks, but the conversation with your orthodontist of that particular case or somebody that you chose from OrthoBrain to have this discussion about whether we move the canine, whether we tilt the lateral, and that's going to be an unbelievable educational program. But what happens when we bring in, how does a practice bring in a clear aligner program? It's not like you walk in Monday and you say, Monday, we're going to bring it in. That's it. Well, first of all, I want you to know that your doctors are going to see more cosmetic cases and I believe more implant cases because we've seen it. And it's the same concept. If you have anterior crowding and somebody wants to come in and we separate those teeth out, perfect, periodontally sound, we tell the patients now we can close the diastema. We can close the spaces and we can have beautiful smile with 8 laminates after the ortho case. So the other type of situation, if you have some crowding or lost tooth in the posterior that you want to upright a molar or clear space to put in an implant to hold the space. This is the type of dentistry that we see with clear aligners. It's not just straighten the teeth, but I'll tell you what comes after almost all cases of clear aligners is a bleaching to get these patients straight white teeth, which is something everybody wants. So let's talk some of the economics, which is really eye-opening. And we're going to show you this, but if we charge, now there are some fees, $65, $68, $7,200 for a clear aligner case, but let's say we charged $5,500. $5,500, that's all. And we did, and I brought a little calculator because I calculated these things, but let's say you're pulling out $5,500 and you start, I'm not saying to do the old saying one a day, but let's say we do 2 a week. We see 2 patients in our practice. I do believe that's a little low, but let's say we have a strong hygiene program. We bring hygiene in. We bring a third-party payment in for our treatment coordinators or our office managers, and we develop that we want to start clear aligners. And I'm going to tell you how simple this is. You're going to develop clear aligners by talking to your staff, by talking to the team, and saying, we want to implement this into our practice. I guarantee you they will be excited. I guarantee you they'll be incredibly uplifted that they can talk about another procedure that we're offering in the practice. And subsequently, you give them a little bonus or a finder's fee if you want. I do that because everybody's involved. The whole team is a team. But my feeling is at $5,500, and we're going to go through the course of OrthoBrain. It's going to be very reasonable. But let's say it's $5,500 times 2, times 4, times 12. So that's times 2 is a week, times 4 is a month, times 12 for the year. If you do 2 clear aligner cases a week at $5,500, your gross revenue is $528,000 more a year. That means if I did 1 case a week, I'd be $260,000, $250,000. That's an extra easy $125,000 in my pocket, or an extra $75,000 in my pocket if my associate did it. So what I'm saying to you is to not do it is to sort of say that there's an avenue of dentistry that I don't want to even touch, and I don't care about the revenue stream. But here's something really earth-shattering. And $5,500 for a clear aligner case is very reasonable. But let's say we go through, and this is just having fun with it, because I'm going to talk to you about somebody that I met along my travels, and it was earth-shattering. And that was a doctor who was definitely in his late 60s, maybe 70, 71 years old. And we were looking at his practice to possibly acquire through a group that I'm affiliated with, and that's Guardian. And I went to see him, and we talked. And this gentleman, after 25, 30 years of dentistry, devoted his entire day of clinical work, 3 days a week, to clear aligners. That's all he did was clear aligners. He had a general dentist come in twice a week, a hygienist 3-4 days a week. He did $2 million in clear aligners. And he said, it's clean, it's neat, it saves my back. But I'm saying with everything that goes on, it was incredible. Now, that's a tough practice to sell if you're not selling it to a diamond or to somebody who's really knowledgeable in clear aligners. So it's a little bit of a scary endeavor. But when you bring it into your practice, for instance, the one a day. Now, this gentleman was in Manhattan. But let's say we take a very reasonable $6,200 case times 4. That's one a day, and you're only open 4 days a week. Times 4 is 4 weeks in a month. Times 12. So we're doing one a day. If I have 2 hygienists in my practice and I get 3 to 4 new patients a day or 2 patients new a day, that opens the avenue for almost 20 patients, 16 to 18 patients that I have to choose one clear aligner case. And I'm saying that if we feel comfortable with root canals, we know when there's a perf, we're going to do a root canal. If we feel comfortable with clear aligners, we know we're going to look and find clear aligners. Now, I don't want to spend 30 minutes talking to you about clear aligners and then move on. We're developing a program here at Dentistry Beyond the Numbers, and that is to develop action plans, things that I've come across that I feel will help tremendously. And tremendously means getting doctors to that $800, $700 an hour production. Remember, we talked about that. At $700 an hour production for a GP, right? If you do 40 hours a week, that GP is producing about $1.3 million. And if clear aligners can increase him with nothing but scanning impressions, we're looking at $1.6 million, $1.7 million. From productivity standpoint, what does that lead us to? Retention of team, retention of doctors, bringing us into an age of technology. You're scanning, you're looking at orthodontics, you're looking at moving teeth for the betterment of the patient's either gingiva, periodontal health, restorative needs, whitening needs, cosmetic needs. I'm not an orthodontist, but I've seen young doctors gravitate to this procedure and do it on such an array of cases that it's really amazing. But more importantly, the satisfaction they get from doing these cases, and when the gals come out, when the guys come out and they smile, there's a tremendous feeling. And again, I believe that in today's world, we as clinicians have such a tremendous opportunity to do these modalities and do them well. You know, it's really earth-shattering to me that if you go through all the vendors in a show and all the things that are out there for us general dentists to learn, super general dentist is not out there. It's not crazy. I mean, every row in a show has more things for us, whether it be computer technology for integrating implants or guides for orthos, for orthodontic companies to make it easier with orthodontists that are consulting with us and sending back discs with treatment plans. It's really exciting. Now we have endodontics through Rotary that it depicts the apex and tells us how far to go and then to easily fill up the canals. Dentistry is definitely moving into an age that's so exciting and so new that even the older docs, even docs like myself that want to get involved in things, can do it with companies like OrthoBrain without doing it where you have to go and maybe people don't want to get certified into something now. But the fact is that it's out there. And, you know, and this is the situation that I would strongly advise. If I'm a single doctor, I will bring in an associate and establish that, because if I want to phase out, one of the best ways of finding revenue to not lose anything, but also increase the patient load on my associate, is to do things that I'm not doing. And we're going to get into that. And I always talk about that. We call it procedural matching. Whatever procedure you're not doing, and clear aligners is an amazing opportunity for you docs that aren't doing it enough or not doing it at all, or the groups that find docs that are just laboring in it, perhaps this could be a tremendous help, because this allows the dentist, the young associate, to learn. You see, part of the learning is occlusion. They're going to go do all these implant cases, and they're not going to have a great idea of guidance. Is it group function? Is it canine guidance? Is it anterior excursion movements? I could talk about that to a young associate. They'll never know what I'm talking about. Doing orthodontics and understanding the occlusion from the treatment plan of somebody so experienced as the doctors you talk on these cases with will be so enlightening for so many things in dentistry that I stand behind what I said, and that is dentistry begets more dentistry. And that's because our knowledge base will grow. And to me, this is one of the steps that get us to so many things, meaning just accepting a procedure that should be done in dentistry. It's almost standard of care to bring these things into our practices. Hygienists love it. Dentists, young associates gravitate to it. And many of us clinicians that have experienced love it for the ease of it and the results of it. But the economics is not to be overlooked. Please look into this. What we're doing in the future, in the next episode, will be bring in a doctor that implemented OrthoBrain into his practice and what he learned and how he grew. It's really exciting. Please know that everything we do in Dentistry Beyond the Numbers is to bring you the best way to develop a tremendous practice, being a super generalist in every aspect of our profession. And that's my goal. Today, we're dealing with the thumb. Gravitate. Look at it. We're going to expand on it. Thank you. If you like us, please like us on all the platforms. Gives us an opportunity to keep growing and get the best guests and get the best situations. And please let us know what you want to talk about. But right now, we are diving into the super generalist of the dental Hamsa. We'll see you next time on Dentistry Beyond the Numbers.